join us here on your regular program, The Physicians, where your health is our business. Today we'll be discussing non-pharmacological control of pain during labor. In the studio with me, we have our guest. He is a consultant obstetrician and gynecologist, the MD, CEO of LOUISMED Specialist Hospital. No other one than our very delectable Professor Anthony Akinloye Bamigboye. Prof, you're welcome to our program.
I'm very happy indeed being here once again.
You're welcome, sir.
It's a pleasure.
Thank you. So we're discussing the non-pharmacological control of pain during labor. Myself and my colleague who actually talks about it, and she doesn't experience pain. Like she said, most times actually max, okay? But for some people, for some patients, they just keep banging the bed. Anyone that comes to them, they will grab. But for some other, they can't even bear the pain. They will ask, please, doctor, give me, for each contraction, they will ask for a medication, an analgesic to be given to them to assist them. But in my own case, I know very well that no matter the pain, at the end of it, what comes out is what is more important. So I just psych myself and say, this will end after the baby comes out. So now as a professor, I'm sure you have seen a lot of cases. You have experienced people talking about it too. So what are the non-pharmacological control methods of pain, controlling it during labor?
Thank you for bringing out this, doctor. It's important for my viewers at home to listen to this story which I want to give. This was around about year 2000 or 1999. I had this woman in antenatal booked to see me because of me, whatever that meant. And I said, yes, see me. I was seeing her until she was 10. But unfortunately, I had to go to New York to give a lecture on the research that I just did. So they were calling me from New York, and this lady was actually ninth month, the 40th week. And I went to New York that day, and then there came a phone call. Then I was a doctor. So, doctor, I have got a pain. I'm in labor. I said, okay, go and see my colleague, also a gynecologist. I said, no, I paid for you and I want to see you. I said, go to the hospital and go and see my colleague, or go to the labor ward. They will attend to you there. Alas, she declined. I said, okay, I'm coming. Because I knew what will happen. Because when the pain comes now, she will have nowhere to run to. Because pain is an emotional, expression of stimuli, So this woman dropped. Then I went for my lecture, only for me to come back. I said, Professor, I got the pain now. I'm in labor ward. Oh, okay. But she said, no, now I'm there. She was still talking. I said, okay, the pain is probably not yet there. And then after a while, I didn't hear anything. Only for me to hear that she has given birth after 3 hours. Okay. It means the pain was not there. So therefore, every woman is bound to have pain when in labor. And in fact, all mamas are enshrined or they are endowed to have pain. There are several methods for control of pain during labor. And these methods have to be explored. There are those that we intervene with medications, and there are those that we do not use medications. The ones we do not use medications, they are advantaged by the fact that we do not have complications or side effects. Therefore, such methods should be explored in the quest for alleviating pain in labor. In women all over the world, we know that supporting those in labor, the so-called doula support by the partner or someone nearby, is of paramount importance. We equally know that other method of touching, massage, other therapies, swimming, and so on and so forth, will be also of immense advantage. It's been shown everywhere that if you bring your partner to the labor ward, the pain is reduced. The intervention like operation is reduced. The the babies come out a bit earlier than normal. Then the babies cry better. Okay, so that is an intervention in medicine that cannot be surpassed with anything, because you are not spending anything. The government of the world is not spending a dime.
Okay.
Yet you are achieving what you achieve if you are given medication.
Okay. The dollar one, and you also talked about the music. So when we come back, we'll discuss more. We need to keep a date with the physicians to hear what you have to say about non-pharmacological methods of control of pain during labor. What have you used? Are you part of one of those that will put this cloth on your head, that the cloth should not come down? Because if the cloth comes down, the pain will increase. Because in labor, what I've seen, a lot of patients come that way, putting cloth on their head, that this cloth on my head ensures that the pain does not continue. Are you one of those ones? How about you? Are you one of those people that will also put safety pin on your cloth, just because you don't want the pain to progress? Is it a myth or not? Let's hear from you. How are the ways, what methods did you use in controlling pain apart from using medication when you're in labor? We're back after this short break. Stay tuned.
Okay, so this is a very funny question because I have 2 children. Even if my last is 18, that pain you don't forget. So these methods that you're talking about, it does not stop or control the pain. It actually controls the woman in pain, but it does not control the pain. It only allows you to keep energy for when the time for the child to come out reaches. That's all it does. Well, yes, massages, breathing. Yeah, I did a lot of breathing exercise, but that one did not stop the pain. I don't think anything. I think that the only thing that can stop the pain is painkillers, which is not really good because it delays the labor process. But say control pain, not really stop, because the pain does not stop, but it controls the pain to an extent. Are painkillers, which is epidural and some of all those methods that people use. But breathing exercise will only help you to stay in control of yourself. It does not control the pain in any way. Thank you very much.
Welcome back. If you have just joined us, you're onto your regular program, The Physicians, where your health is our business. We've been discussing non-pharmacological control of pain during labor. And in the studio, Professor Akinloye, Anthony Bamigboye, the MD CEO of LOUISMED Specialist Hospital, has been doing justice to this topic. He told us about the non-pharmacological method. He did mention the dollar method. He also talked about music, how it affects people, how it also helps people during labor, when they're in labor. So we want to meet him so that he can tell us more. If you're not one who appreciates music, maybe by the time he's done, you'll find where you actually belong. Prof, let's continue. So we've talked about the dollar one, and you also talked about the music. So what other ones, the non-pharmacological methods? Because I also heard some people talk about swimming, going to the pool. So let's hear from you, Prof.
Yes, we commenced a study in about 1975, okay, comparing those who give birth while staying in a pool versus those who do not, or those who stay in the bath versus those who do not. We realized that staying in the bath, especially if the water covers up from your trunk downwards, does a lot of good.
More soothing?
It's more soothing. Probably, you use less analgesic. The Apgar score for the baby when it's born is better. And the pain afterwards is also better. The bonding between the husband and the father and the couple is much better. So that is therefore a method of choice. However, there are people who thought maybe, okay, if I'm going to give birth and I ended up giving birth in the water, it's a problem. It is not. Because the baby they normally stay inside water. Amniotic fluid. So
So
there's nothing special about you if you mistakenly give birth in the bath. So be it. Baby will be dragged out later on, clean and whatever it is, and the process continues. So staying in water or swimming pool is actually beneficial for those services. If they're there, yeah, it is. That's another one.
Is that usually a home method of delivery or hospital based? Having baby in water.
I think it can be both.
But I think it's preferable to have it hospital yeah, because of emergency in case of anything. So they would prefer to do it in the hospital. I have not advocated giving birth at home in the water, but the hospital, yes, it is.
I know for my last child, they asked me if I wanted to stay in the water. I just looked at the nurse.
Are you mad?
I did not even.
African
mentality.
I'm sorry.
Like,
even after delivery, maybe not, that's yours. Because even after delivery, they brought ice.
Yeah.
That I should take. I didn't.
No. I think that ice thing. Prof, please.
I'm going to go.
Ice before.
I'm going to go towards
it. So
you see, that one is the heat therapy, whereby you have heat and you have cold. So if you have a cold compress, you place it on the perineum in front. Okay, and somebody then puts hot one at the back. So they are contrasting things, So you won't believe it. The pain is less.
Wow. So
you are combined hot or cold here, hot at the back.
Wow.
You know, at the area of the sacrum. Yeah.
Wow.
So that's fine.
And the pain reduces.
And the pain goes down.
Is there any?
How to explain it?
Yes.
I think it's part of psychology or acupuncture.
Okay.
Because some nerve endings are going to be affected.
Okay.
You know, they kind of. It works.
Obviously.
Research. That's what research is all about.
Okay.
It works. So that is heat therapy versus cold therapy. We cannot believe in instructions that are not medical intervention because it does a lot of good in women. Yeah. Even posture. If a woman lies down, she's feeling pain, she will naturally adjust the position to where it will suit her. Then, if it suits her, then you encourage her to choose that one to use. So there's no defined method. But the only thing that we know is that don't let your women in labor lie on their back. It's not nice. Because we know the pressure of the baby will press on the inferior vena cava, on the blood vessels of the tummy, then the cardiac input is low, the output is low, then it's not good for the baby. So, but they can then choose which position that they want. If, for example, a woman says, I prefer standing up, allow them to stand up. If a woman says, I prefer to stoop, let her stoop.
I think I'm happy you're saying this now, and I'm sure even the medical people, the caregivers are hearing this. Because oftentimes the woman will want to stand up and they say, no, the baby is going to come out. Don't stand, just on the bed. Just restricting the woman. Even when you want to use the restroom, they say, don't go in the
toilet.
Yes. Like they are going to contaminate this thing. But what happens to women that are in labor and they are sleepy?
Sleepy?
Yeah, they feel sleepy. Some even fall asleep.
Good. Why not? Let them sleep. It's fine.
Wow.
I don't have anything against
maybe
it.
There was some,
no.
reason why, or it could be a complication. Why would you this active labor and then you are sleeping?
It means their physiology is not like everybody else. We expect them to feel pain, but they are not feeling pain. And when they are not feeling that pain, then they sleep. So what would they be doing? Or I've seen women in active labor pressing phones, testing.
Wow.
It means they are not feeling it.
As much as you expect
you expect them. It's fine.
Okay.
Yeah.
Do we say cultural beliefs also can it be classified as a non-pharmacological control of pain during labor?
Cultural and religious belief.
Yes, cultural and religious belief. Does it really help?
Yeah, like some cultures, they believe that labor pain is normal. It's a way of life. It's another way of life. So there's nothing special about it. As I said earlier on, I said that all mamas are supposed to have pain. But we human beings, we got the cortex, the brain, to modify the pain. That's why we go for epidural and so on. But that does not mean that we do not have pain. So our culture, our religion that stimulates us to have pain, we have accepted it. So that's what we use to modify everything. So it does have a role.
Can we also say, okay, you already talked about it, walking briskly?
Yeah.
Can also help to take
there are many
this.
myths. And the purpose of this talk is actually to let our viewers know what is right and what is wrong. Yeah. We do all sorts of things that if they walk, the walking posture, walking can also help. They tell them to walk around. Yeah. You see, when they give you ask you to crash, they are diverting. It's a diversional therapy. It's because the ice cream is burning you and you are busy showing me it's taking the pain away. So it's a way. So diversional therapy is one of those. And another diversional therapy is breathing. They tell you are in labor. You take a deep breath.
Yes.
Then in, you exhale out. You see, when you are doing that, you are subconsciously aware that you are breathing.
Yes.
So it's a kind of taking your mind away from the pain. Yeah.
At the moment in pain, you remember the pain. Which breathing is that one? So, Prof, I think it would be a good thing if during antenatal, the caregivers during that health talk, tell the mothers what to expect. And the pharmacological methods of control of pain during labor and the non-pharmacological methods. So they are aware that these ones also help. Not only using medication, because during labor, as soon as the pain comes, all they want is anything that can stop that pain. Just give me that injection. But if they also know these ones, I think the onus is actually on the caregivers to enlighten these women on what to do.
Yes, it is. And in some units, like in my practice in South Africa, I have a unit whereby during antenatal, they teach women everything that they need to know. So then they add up everything together. Once they are aware of those things, those interventions, they put them into practice when they are in labor, especially when their doula or their partner is available. So really, there are so many things that could be done. Breathing is one. Heat therapy is another one. Acupuncture is there. Acupressure is again also is there. Hydrotherapy, doula support that the person is actually available to assist you is there. Touching, changing position, all sort of things are there for our use.
What about sexual intercourse before the delivery?
That's another kettle of fish. Okay, let me quickly summarize it. When there's this story that when you are near labor, you must have intercourse. Let me explain it. How it originated. Scientifically, we know that semen, which is the mixture of sperm and the prostatic fluid, contains a hormone similar to oxytocin.
Oh, really?
Yes, it contains prostaglandins. Prostaglandins are known to cause uterine contraction. So a woman who is noted to be 40 weeks and 41 weeks are not going into labor, they will tell her, go and meet your husband.
Okay.
So now the husband then will come back to the doctor and say, hey, this woman is too heavy. How do I do it? Then we advise him to go through the back.
Okay.
Okay. So and that inject
helps.
that.
Okay.
Yes, yeah, that's the way it.
Okay.
Why
It's
so-
not pharmacological
Is that
It's a-
is
it's a-
actually
it's a
not pharmacological control method?
because you're not even in
Yes.
labor pain at
No,
that
no,
point,
it's not
at least
about
pre-labor.
yeah,
It will
it's
help to
always
reduce
induction.
contraction.
Yeah.
So thank you very much, Professor Akinloye, Bamigboye, for coming on our program again. And
Thank you.
it's always a pleasure having you as a guest because we're always very enlightened. Our viewers out there are always very enlightened. So much that you always ditch out each time you come. Now you've schooled us on non-pharmacological control of pain during labor. You already talked about so many, the relaxation technique, the doula support, music therapy, the massage, and of course the hydrotherapy and the acupressure. I'm sure our viewers will always remember them. They know now that it is not only the use of medication that will help them, but others, the non-pharmacological method. So thank you so much for coming on our program. We ask that, we pray that anytime we call on you, you always honor us because our viewers out there really love you and they always want to hear from you. And to our viewers again, I want to say thank you for keeping a date with us on your regular program, The Physicians, where your head is our business. We talked about the non-pharmacological control of pain during labor, and the consultant talked about different methods. You don't have to use just medication. You don't need them unless it is absolutely necessary. But before then, there are other ways that you can actually help. Instead of popping those pills or taking those injections, you can actually use the relaxation technique. You can do some little exercises, brisk walking. There's also the hydrotherapy. Those that can swim can swim. If you can't even swim, there's water in your bath. You can just sit there and let it be above the abdomen, just a little bit above the abdomen. It will also help. You can also have the hydrotherapy like you talked about. You can have both the warm and the cold type. You can put the water bottle in front, the cold one, and put the warm one behind. It works actually. Not going to use pin, putting safety pin on your wrapper, not putting something like a sheet on your neck, on your head. Those ones are just myth. The real ones are using the cold compress. It will also help you. So I pray and I hope that you always keep a date with us. Till next time, stay blessed. My name still remains Dr. Martina Agbere.
Thank you very much, Prof, for this amazing lecture. You've all heard it, dear viewers. Childbirth is one of the largest events for the emotional life of a pregnant woman. So pain comes naturally when you are in labor. Now you've been schooled on the different non-pharmacological way. You can educate yourself or tell people around you that there are numerous ways. It doesn't have to be just medication. Please kindly follow us on all our various social media platforms, Twitter, Instagram, Facebook. And we have loads of episodes for you, almost 200 episodes on our YouTube page, The Physicians NG. Please binge on them, get enlightened, get educated, because health is wealth and it's good for you to understand exactly how healthy you can be just by watching our previous episodes. And if you want to be a part of this program, you are just a click away. Go to our website, fill the form, and you'll be right there just the way Professor Bamigboye is. I remain Dr. Memuna Yusuf Kadri. Until next time, remain blessed.